I mean, then what's your option? There's nothing left but to run away. And so then I can tell you what we know from 50 years of studying the outcome of clinical psychological interventions. So let's take an extreme case, right? Let's say something truly terrible has happened to you, and as a consequence of that, you're in shock, post-traumatic shock, which is a condition that's sufficiently serious to damage your brain over time. It's not only a psychological disorder, it's a physical disorder. If you're really stressed, your cortisol levels shoot up. And if your cortisol levels shoot up, that cortisol in high doses is a neurotoxin. It starts to damage your brain. So let's take a very extreme case and imagine that you've been violently sexually assaulted, and as a consequence of that, you're in post-traumatic shock. How do you get cured? So that means you can't really go outside. You certainly can't encounter anything that's associated with the event. Your sense of integrity and personal safety has been completely destroyed. Is there any way you can get back on your feet? No, there's a woman named Edna Foa in New York, I think one of the world's top clinical psychologists, and she's been dealing with women who have post-traumatic stress disorder for decades. And she's found a treatment that works. And the treatment is this. She has the women relive the event in as much detail as possible, over and over in their imagination, with the accompanying emotion. And she's found, because she's done physiological measurements on her clients, that those women that allow themselves to get the most fully upset as a consequence of the reliving get better faster and stay better longer. The clinical evidence is absolutely clear.